So for more reaction, we now welcome Dr. Bharat Pankania, a senior clinical lecturer at the University of Exeter, and he joins us from Bath. Always good to see you, Doctor. Thank you so much, as always, for your time. So since the Omicron variant was identified, many experts have agreed that it is more contagious but doesn't cause as severe illness. So this study seems to disagree. Your reaction to these findings?
So this is a study, and it is important for everyone to know it is a modeling study. It is a modeling study of immunology imposed upon a population and then to predict and project outcomes. And as it is a modeling study, we need to take it cautiously, and we just don't say, therefore it is. It may not be it. It may be that what we have experienced in South Africa, i.e. it's more infectious, more vaccine bypassing, that bit I accept. With respect to, is it more disease causing? Time will tell. Time will tell, therefore keep calm and be watchful, but don't get hairs running.
And to that exact point about this being a modeling form of research, as you described it, it also found Omicron 5 times more likely to cause reinfections. Is it too soon to reach that conclusion? How worrying is this?
Well, we do know, and if we look at the trajectory of new cases graphs, that shows to us very clearly that Omicron is much more infectious. So that bit we have to accept that, yes, it is much more infectious. And we also know that because Omicron is different to Delta and the vaccines were developed when the original virus came about, that it may be less effective against Omicron. Those bits we know. What we don't know is, as we said before, is it severe disease causing?
And given the situation that is unfolding right now, particularly in the UK, are you confident that the healthcare system there is able to cope with a possible uptick in cases over this festive period?
It's very much touch and go. So there's a lot of pressure with hospitals full because it is the winter period. And also we've got staff absences, staff ill, staff fearful, staff ill for whatever other reason. So there is a perfect storm brewing. And what we need is to reduce case numbers in case those case numbers translate into hospital admissions in 2 to 3 weeks' time.
Talking about efforts to reduce cases the world over, there is much controversy here in Israel over a travel ban. Given these new findings, do you think shutting borders is effective right now, or has that ship sailed, so to speak? Is it too late to contain this global spread effectively at this point?
I think the ship has sailed, and politicians need to be seen to be doing something. Therefore, they do what they do is put countries on red lists. Let's think about it. You've got infections in Israel. We've got infections in the UK. What's the difference if people between Israel and the UK are moving along? It's not as if all travelers from the UK to Israel are infected and infectious or the other way around. What we really need is checks and balances, and the checks are you sure you're not bringing in new horrible variants of concern into our country, rather than saying, I'm going to close all my borders. It never works. It's a reaction by politicians.
And talking about what world leaders should be doing right now, of course, Christmas is around the corner, New Year's celebrations too. What should authorities be doing? Nobody wants another bleak festive season or a resurgence of cases either. What advice would you give to leaders right now?
Well, follow the science, and the science tells you we've got something highly infectious. Apply the brakes, go cautious. Economy and health go together. It's not a case of health wins over economy. They all work together. Therefore, apply the brakes, reduce the case numbers, save the lives. And furthermore, do your homework for the new year, which is we must immunize the rest of the world, because if we don't do it, variants like Omicron keep on cropping up, and we don't want that because that puts us many steps back. So help countries like Africa and other poorer nations to also immunize their population.
Dr. Bharat Pankaneer, always a pleasure hearing your insights live from Bath. Thank you so much for your time.
Thank you.